Welcome to the MD Edge Daily News for Friday, August 31st. I'm your host, Nick Andrews.
And I'm MD Edge editor Mary Ellen Schneider. Today, bone biopsy for osteomyelitis can vary widely.
Also today, variation in bacterial drug susceptibility is tied to risk of TB relapse.
And later, CTA cuts myocardial infarction in patients with stable chest pain.
But we begin with new data on Rivaroxaban for extended treatment of venous thromboembolism. Both low-dose and full-dose Rivaroxaban had superior benefit-risk profiles for extended VTE compared with aspirin. This is according to a study published in Thrombosis Research. Dr. Paolo Prandoni is a researcher at the University of Padua in Italy. Dr. Prandoni says that these findings indicate that there is no longer a place for extended VTE treatment with aspirin. In the study, researchers analyzed data from more than 3,300 patients with DVT or PE who had previously received anticoagulant treatment for 6 to 12 months. Patients were given either once-daily Rivaroxaban at low dose, Rivaroxaban at full dose, or once-daily aspirin. Benefit and risk were calculated using excess numbers of events or the difference in cumulative incidence. In patients treated with the full dose of Rivaroxaban instead of aspirin, there would be 123 fewer episodes of PE and nearly 200 fewer episodes of DVT. In patients giving 10 milligrams of Rivaroxaban instead of aspirin, there would be 121 fewer episodes of PE and more than 200 fewer episodes of DVT. The researchers also report that compared with aspirin, one additional symptomatic recurrent VTE or major bleed would be avoided for every 30 or so patients treated with Rivaroxaban, regardless of the dose.
Diabetic foot ulcers and infections can lead to osteomyelitis, a potentially devastating infection in the bone. But how much of a difference can osteomyelitis make to a patient's prognosis? Well, Dr. Benjamin Lipsky of the University of Washington in Seattle says that overall, about 20% of patients with diabetic foot infection have underlying osteomyelitis, which can dramatically increase the risk of lower extremity amputation. Proper diagnosis of osteomyelitis, which relies on a bone biopsy, is clearly important. However, new research shows there's a big gap in diagnostic findings depending on whether doctors request culture or histology results. This research was presented at the 2018 annual scientific sessions of the American Diabetes Association. Dr. Peter Crisologo is a researcher with the University of Texas Southwestern Medical Center in Dallas. Dr. Crisologo spoke with MD Edge to help explain what he and his colleagues found, as well as to offer guidance to physicians who request bone biopsies. He says that these findings do not provide enough evidence to use one method over another. The main purpose was to raise awareness that diagnosis can change dramatically depending on how the gold standard of bone biopsy is interpreted. He notes that the best take-home message for physicians who may order bone biopsies for these patients is to request both traditional culture and traditional histology. You can read the full interview transcript by clicking the link in the podcast description.
Higher pre-treatment drug concentrations close to a resistance breakpoint for susceptibility were associated with greater relapse risk in TB. This is according to data published in the New England Journal of Medicine from 54 patients who relapsed and 63 patients who were treated and cured. In the study, the researchers examined pre-treatment bacterial isolates from adults with TB who had experienced relapse and those who were cured. The researchers used the isolates to identify the minimum inhibitory concentration for isoniazid and rifampin. Minimum inhibitory concentration, or MIC, is the lowest concentration of the drug that prevents visible bacterial growth in culture. Overall, high pretreatment MIC values for both isoniazid and rifampin were associated with an increased risk of relapse. Dr. Roberto Colagnelli is a researcher at Rutgers University in Newark, New Jersey. Dr. Colagnelli says that he and his colleagues postulated that drug-susceptible Mycobacterium tuberculosis might have a graded spectrum of susceptibilities that could be used to determine the risk of relapse. He also notes that the study was limited by small sample size, retrospective design, and the inability to test MIC values from cultures versus subcultures. However, he also says that the results suggest an impact of MIC values on treatment outcomes.
And finally today, from Cardiology News, the use of coronary computed tomographic angiography, or CTA, in patients with stable chest pain reduced the risk of non-fatal heart attack or cardiovascular death by 41% over 5 years. This is according to new research presented at the 2018 Annual Congress of the European Society of Cardiology in Munich. The researchers note that the absolute numbers in the study were small. There were 48 clinical events in the intervention group and 81 among patients who had standard care. However, the difference was significant. They also say that the intervention was not associated with any increase in invasive coronary procedures. The study was also published in the New England Journal of Medicine. The SCOT-HEART study is an open-label trial that randomly assigned more than 4,000 patients with stable chest pain to either standard care plus CTA or standard care alone. The primary endpoint was non-fatal MI, or death from coronary heart disease at 5 years. Patients who underwent CTA were more likely to start preventive therapies and anti-anginal therapies, and although there were more revascularizations in that group early on, the numbers were similar by the end of follow-up. At 12 months, CTA patients were 30% less likely to undergo invasive coronary angiography and 41% less likely to undergo a coronary revascularization. Dr. David Newby is at the University of Edinburgh in Scotland. He says that these findings suggest that the use of CTA resulted in more correct diagnoses of coronary heart disease than standard care alone, which then led to the use of appropriate therapies. This change in management resulted in fewer clinical events in the CTA group than in the control group. That concludes the final daily news for the month of August. And speaking of ESC 2018, our coverage team unwraps the meeting in today's CardioCast. If you missed ESC 2018 or wanted to hear more about trials like this one, check out the MD Edge CardioCast. For MD Edge, I'm Mary Ellen Schneider.
And I'm Nick Andrews. The MD Edge CardioCast, the MD Edge SiteCast, and the MD Edge Daily News are all available wherever you get your podcasts. Subscribe today and make the day's top medical news a part of your daily routine. The MD Edge Daily News is taking a Labor Day break. We'll be back on Tuesday, September 4th. We wish you and yours a happy, safe holiday.